Okay, so now you've had surgery. You've done everything before surgery to make sure you have the best outcomes, and it's finally happened. So now let's talk about the things you can do after surgery that are really important for your care and recovery. After surgery, you're going to expect mild to moderate soreness and tightness in your muscles. You're going to manage that with medications and muscle relaxers. You want to make sure you're using those as your doctor prescribes so that you can stay ahead of your pain. You don't let the pain get ahead of you. Other strategies to manage your pain include taking showers, deep breathing, relaxation techniques, and using a heat pad. You want to remember overall that some days are going to be better than others. After your surgery, your body still needs time to heal, so as long as you're moving in the right direction overall, you're progressing well. As far as your incision goes, you want to keep your incision clean, no ointments, and you want to make sure you don't get in a bathtub or swimming pool for at least 2 to 3 weeks after surgery to make sure that incision has had time to heal. You also want to make sure you have an active recovery after surgery. It's not time to sit around and lay down. It is not a vacation. You've got to get up and get moving to keep yourself as healthy as possible. Right after surgery, they're going to encourage you to walk and do ankle pumps. And if there's any particular activities that you want to do after surgery, you could talk to your surgical team at your first post-op visit to see when is an appropriate timeline to return. You need to remember that recovery does not mean sitting. You want to be as active as possible. And one helpful tip for that is to put a timer on your phone for every hour. You're going to get up and you're going to walk as much as you can tolerate. That'll help you stay moving and keep your blood flowing and reduce the risk of blood clots as well. You want to make sure you're following your restrictions after spine surgery to make sure you're healing. Those restrictions typically involve lifting no more than 5 to 10 pounds your first 3 to 4 weeks after surgery, no driving for the first few days or while on certain medications for your safety and the safety of others, and maintaining your bending, lifting, and twisting principles. If you remember BLT, you remember that you want to minimize bending, minimize lifting, and minimize twisting after spine surgery, as those movements tend to put the most stress on a healing spine.